So to begin with the new chapter, tubular functions. The steps of the urine formation includes three main steps: the ultrafiltration of the plasma through the renal corpuscle, the reabsorption of the water and the solutes from the tubular fluid, and the secretion of the selected solutes into the tubular fluid, which can be seen in this is the glomerular filtration, tubular reabsorption, and tubular secretion. The tubular handling of the filtrate is the most important step in the process of the urine formation. Glomerular filtration is a non-specific process in the sense that the mechanism of the filtration is not different from the water and the different solutes, whereas the tubular transport are the selective processes. Second, tubular exchange of the water and the electrolytes finally determines the volume and the composition of the urine. The determination by modulating the reabsorption and the secretion of the substances of its luminal fluid, renal tubule plays an important role in the control of the composition, osmolality, pH, and the volume of the ECF. Then, usually glucose, bicarbonate are almost reabsorbed completely. Water, sodium chloride are reabsorbed more than 99%. K plus is reabsorbed more than 90%, and urea is reabsorbed about 50% of the filtrate in the renal tubules. In the common principles of the tubular functions, the transport mechanism, there are two types of transport mechanism: passive transport mechanism and the active transport mechanism. Passive transport mechanism, we see diffusion, we know the definition, and in diffusion, especially uncharged solutes like glucose are transported by this mechanism. Though the charged solutes, especially the ions, are also transported by this diffusion, their electrical gradient greatly influences this passive transport. Then comes the facilitated diffusion. Reabsorption of the glucose by the glucose transporter is an example of this facilitated diffusion. Sodium and the potassium ions are reabsorbed from the kidney tubule through the water filled channels created by the carrier protein. The transport of the glucose protein and the urea from the tubular fluid are the other examples of the facilitated diffusion. The coupled transport, which is in the form of the facilitated diffusion, serves as the major mechanism for the transport of the solutes in the tubules. There are two types of coupled transport mechanism: the symport mechanism and the antiport mechanism. The symport mechanism process of the coupled transport mechanism of the two or more solutes in the same direction by the carrier protein. The examples are the Na plus glucose and Na plus amino acid, etc. The antiport mechanism is the process of coupled transport of the two or more solutes in the opposite direction by the carrier protein. An example is the Na plus H plus exchange in proximal tubule that reabsorb the Na plus from the tubular fluid in exchange for secretion of the H plus into it. Then is a solvent drag. When bulk amount of the water is reabsorbed, the solutes dissolved in the water are also transported along with the water across the tubular epithelium. This is called as a solvent drag. This contributes to the reabsorption of the substantial amounts of the solutes in the proximal convoluted tubule. What is osmosis? Water is reabsorbed along with the solutes to maintain the osmotic balance. This is a major mechanism for the reabsorption of the water from the tubular lumen. For example, water reabsorption follows the reabsorption of the Na plus and the Cl minus from the tubular fluid. Conversely, increased osmolality of the tubular fluid increases the water excretion known as the osmotic diuresis. Glycosuria causes the osmotic diuresis. Osmotic diuresis typically occurs in the diabetes mellitus. In diabetes mellitus, when the plasma glucose is more than the renal threshold, glucose appears in the urine called as the glycosuria. More glucose in the tubular fluid causes the water retention that leads to the polyuria. This differentiates from the water diuresis seen in the diabetes insipidus that occurs due to the ADH deficiency. Coming on to the active transport mechanism, it is a mechanism which utilizes the ATP. Example, the Na plus K plus pump located in the basolateral membrane of the tubular epithelial cells pumps the sodium out of the tubular epithelial cell and potassium into the cell. Other examples include the H plus ATPase, H plus K plus ATPase, calcium ATPase. The secondary active transport like the Na plus glucose and associated solutes are reabsorbed. Na plus K plus ATPase creates a low concentration of the Na plus in the tubular cells. Therefore, the Na plus is reabsorbed from the tubular fluid along its concentration gradient into the tubular cells. The carrier protein of the Na plus facilitates the reabsorption of the Na plus into the tubular cells. Glucose is reabsorbed by the same carrier protein that reabsorbs the Na plus. Reabsorption of the glucose by this mechanism is an example of the secondary active transport. The key concept in the transport mechanism. First comes the paracellular pathway of the transport. Close to the apical membrane of the tubular epithelial cells at the tight junction. Immediately after the tight junction between the epithelial cells and the lateral immediately after the tight junction between the epithelial cells, the lateral intercellular spaces starts, which can be seen over here. This is the tubular epithelial cell, this is the tight junction, this is the lateral intercellular space, and this shows the paracellular pathway. The tight junction, however, have some leaky channels. When the transport of the solute and the water occurs between the cells through the tight junction and the lateral intercellular space, the process is called the transport across the paracellular pathway. Considerable quantity of the calcium and the potassium are reabsorbed in the proximal tubule. Also, some sodium and water are absorbed via paracellular pathway. This is to differentiate from the transcellular pathway of the transport, in which the transport occurs through the cell. The transport of the sodium and the glucose from the tubular fluid into the tubular cells are from there into the ECF is the example of a transport via the transcellular pathway. Next comes the transport mechanism. Transport mechanism is the rate at which the tubular maximum transport, the rate at which the tubule maximally transports a particular solute. The amount of the particular solute transported depends upon the amount of the solute in the tubular fluid present up to the transport maximum for the solute. Next, the Tm for the glucose is 375 mg per minute and in males and 300 milligram per minute in females. Next comes the tubular load. The quantity of the solute filtered by the glomerulocapsular filtering barrier and presented to the tubular fluid is called the tubular load. Tubular load determines the amount of the substance to be reabsorbed from the tubule, as normally a constant fraction of the load is reabsorbed by the kidney tubules, which is called as the glomerulotubular balance. The tubular load also determines the Tm, that is transport mechanism for the substances. Tm depends on the plasma concentration of the substance and the rate of the filtration of the substance, that is the plasma concentration into GFR. The Tm for the glucose is 375 mg per minute. Next is the renal threshold. This is the concentration of the solute in the plasma at or above which the solute first appears in the urine or appears more amount than its normal concentration. For example, in glucose is not present in the urine till the renal threshold 180 mg% in the venous plasma. Therefore, the glucosuria occurs when the plasma concentration of the glucose is above 180 mg%.